Hey everybody, it's Beth Potres, President and CEO for Drive My Way. I'm fortunate to be able to catch up today with my good friend, Kristin Kirkpatrick. Hi Kristin, and welcome.
Hi Beth.
Kristin joins us actually today on this Zoom call. We're talking about nutrition, and Kristin is actually an expert. Kristin is running the KAK Consulting company, and she actually is formerly the leader of the Wellness and Nutrition Services Institute at the Cleveland Clinic. So Kristin has done lots of work in the space. She's dedicated her career to helping all of us live a healthier lifestyle. I personally have worked with Kristin together here in the Cleveland area, and we miss her dearly, and I'm excited to catch up with her today in hopes that she can not only help all of us that are trying to cope at home with making better choices, but I'm in particular here today to try to send a message out to all of those drivers that are in our community, that are out there on the front lines helping out with this coronavirus relief effort and really struggling to, basically get access to the simple amenities in life and be able to serve them with some good advice. So welcome, Kristin.
Thank you, Beth. It's an honor, and it's great to connect with you again. And I'm really excited that you asked me to do this because I think, as you said so eloquently, this is an industry, the trucking industry. We're always in such reliance on them, but now more than ever, they are truly no different from our other first responders. So I think that nutrition can be a challenge for any environment, for any individual. It's a challenge for me sometimes, but I think it's even more of a challenge for these men and women that are in this industry. And now there's even more challenges based on some of the closures and things like that. So I'm glad we can have this conversation today.
Great, thanks. Well, Carrie Marinchik, she leads our social and marketing team, and she's got some great questions that we put together to talk to you about. Carrie?
Hi guys, and hi Kristin. Thank you so much for having the opportunity to join us today. We really appreciate having you on here. I know one of the things that we've really been talking to our driver community about is what foods would be recommended for them right now to keep their immunity system performing well.
Yeah. So Carrie, thank you for that question. It's a great one. And you kind of can look at it into two different buckets. The first bucket is which foods should they really try and avoid or limit that we know has a negative impact on the immune system. And then the second bucket is, okay, what are some of the things that we know are very anti-inflammatory, can help boost immune systems, can help boost immune levels. Those are the kind of the two components. And before we get into that, I think it's also important, and this is definitely true for the trucking industry more than ever, is that immunity is also very much based on your sleeping habits as well. So if you're not getting enough sleep, that lowers your immune defenses, and it increases the risk of picking up anything, whether it's COVID-19 or it's the flu or it's just a cold. So I think sleep and stress management are two very big components alongside nutrition. I'm biased to say that I think nutrition is probably the most important component, but those other things I think are really important as well. So let's start with the positive. If you look at foods that help with boosting immunity, what we really see is the benefit of foods that have color. So we're looking at things like plants, any kind of fruits, vegetables. Berries are particularly great because they're so colorful. And the more colorful, the more deep the hue of a fruit or a vegetable, the more benefit you get from all different factors, whether it's disease prevention or immune or anti-inflammatory, whatever the case may be. So, from that perspective, there's certain things that work well in kind of a trucking environment. And I've worked with truckers in the past on kind of what works well and what doesn't work well at all. So like carrots are great. And it doesn't just have to be like the baby carrots. If you have some ability to get whole carrots and you can just kind of gnaw on them over the course of an 11 hour plus day, that's a great snack. It's got vitamin A, beta carotene, that helps with boosting immunity. Berries are great as well. But for a lot of the truckers that I've worked with in the past, they don't want to eat berries all day long because there's a little bit too much sugar. And if they have some sort of insulin resistance or even diabetes, that's not going to be the best option. Carrots have sugar too, of course, but you know, they have a lot of fiber as well. So that helps to break down kind of the absorption of sugar. And berries have fiber as well. So, so those types of colorful options. Apples are great. Apples have so much benefit. I think half the time I think of apples like they don't get the benefit that they deserve based on the environment. I've had some truckers that I've worked with in the past that like they'll have 5 apples in their truck, and before you know it, like they haven't touched them all and they're all gone bad. And so even from an ease factor, like maybe even just getting bags of cut up apples, that could be sometimes more convenient just in terms of, you know, you're driving and that's a better way to do things. Soluble fiber has been found to help with improving immune as well. And so soluble fiber is found in anything that swells in water. So oats are a great source of soluble fiber. So again, if you're able to go into a Walmart, for example, or you're even able to walk into, let's say, a McDonald's or a Panera or something like that, you can get oatmeal. Oatmeal is always a great option. And you can ask that the oatmeal does not come with added sugars, things like that. Or you can ask for half, right? Half, you know, if you're going to put some sort of brown sugar, can you just put half because I want the taste, but I don't want all the sugar. So that would be a great source of soluble fiber. Fruits and vegetables have soluble fiber as well. Insoluble fiber is another good factor, and insoluble fiber are anything that does not swell in water. So when I think of that, I think of nut mixes. So even just having mason jars or little baggies of different nuts, and it doesn't matter what the nut is. I mean, we could get totally into the weeds and talk about how cashews have this and peanuts have this and almonds have this. But what I always tell every one of my patients, including truckers, just have the nut that you like, right? Because that's the one that you're going to end up eating. So even if it's just a trail mix, and if you need to kind of spruce up a trail mix with a little bit of chocolate chips, that's fine too. That's a great option for a care package. So for someone who's sending you something at home, putting something like that together is really easy to do. Other options, jerky can be great. You don't always have to go with a beef jerky. There is salmon jerky, there's turkey jerky, there's chicken jerky. So you can go with some of the beef jerkies if you like, but there are some really great brands out there that have some great sources of more wild jerky like bison or elk or something like that. A lot of the truckers that I've worked with also tend to be hunters. So a lot of them have taken some of their meat, their wild game, and turned those into jerky. That's a good option. The other thing that I think is great is also looking at things that are really high in protein. So what's really non-perishable, easy to bring: protein bars, protein drinks. Okay. So already ready to drink protein drinks are great. Protein bars are great as long as they don't have a lot of sugar. Great options because you can have them anytime and they fill you up. So the problem that I see a lot is that people are snacking on things that don't fill them up. They're snacking on chips or pretzels or something like that. It doesn't fill them up and they end up eating all day long. So we don't want to do that. We want to look at quality and not quantity. And so getting protein, healthy fats through the nuts, things like that, that can really help to boost those things as well. If you're able to get more perishable items, hard-boiled eggs, awesome. Cheese sticks, great. Also good sources of protein, but also keep you full. It takes the body some time to kind of break those things down. Those are some options as well. And I think if we look more high level, kind of the overarching, if there's one thing you can do to improve immunity, what is it? That's really looking at improvements of overall gut health. So we know that our gut microbiota helps to control the rest of our body, our brain, our immune system, our risk of disease, even our weight, even our stress levels, right? I mean, there's some fascinating studies looking at animals that have microbes transported from one stressed animal into a non-stressed animal. And when that animal gets those microbes, they become stressed. That's pretty amazing. So the gut health component is really strong, and there's a lot of data. There's a lot of evidence-based approaches there. So what helps with improvements of that gut health? Anything that's got probiotics. So That could be you wake up in the morning and you're going to take a probiotic supplement. If you feel that you just can't get fermented foods or yogurt or anything like that that's on the road, that's going to help. I'm not a huge fan of supplements to begin with, but probiotic supplements and vitamin D, I think will really help our immune system, not just today and what we're going through, but throughout life. So those are just some options to consider, Carrie. You know, again, if you're sending packages and you can do more perishable, but those are some options that they can actually have in the truck.
Kristin, I just have a quick question. When you were talking about perishable items like fruits and vegetables, as truckers go in, oftentimes they're only have grab and go choices. What's your position on dried fruits and vegetables that come in?
Yeah, so dried fruits will still give you the benefit of the vitamins. You know, a lot of dried fruits won't necessarily have some of the fiber. I mean, some do, some have a ton of fiber, so it depends what the dried fruit is. You know, the real concern with dried fruit is making sure that you don't have a ton of, you know, sugar in them. So the dried fruits that don't have sugar added are dates, prunes, figs, raisins. Those are really the best options, I would say, if you're going to get some dried fruits. I always talk to my patients about creating competition within your body for sugar absorption, right? So if you're going to have something like a date, for example, even though a date is a dried fruit and it's still healthy for you, you have too many dates, that's a lot of sugar, right? So to slow down that absorption of sugar, why don't we take that date and throw it into a trail mix, or have a handful of dates and then a handful of almonds or peanuts, okay? Because the fats and the protein from the nuts will help slow down the absorption of sugar, and that helps with making sure your insulin doesn't increase rapidly and that you don't have these huge highs and lows of blood sugar. So dried fruit is fine, but you don't want to make it your staple of your only fruit or vegetable. Even if you're going to places where they're more fast food, you typically can get some sort of fruits. You know, I didn't notice this until I had kids, but a lot of the fruit options are not even visible until you look at the children's menu. So,
right.
I mean, sometimes you got to go there, right? You can say, okay, if you're at McDonald's, for example, well, I see that there's, or Chick-fil-A or whatever the case may be, I see that this option for the kids menu is they can have an apple or they can have a bag of carrots. Can you throw that in to my meal, or can I have that instead of the fries, right? So just ways to do it. I always say that the menu at any restaurant, even if it's fast food, should be offered to everyone. So if you see something on a kid's menu that works for you, then get it from the kids menu, right? Because a lot of, you know, if you go to a lot of fast food restaurants, you're not going to see apple as an option, but typically it is there for the kids' meals.
Good point.
Absolutely. No, that's phenomenal. From a, you know, an entire standpoint of the care package to immunity to, you know, gut health, I think those tips are exactly, you know, what the drivers have really been asking for these past couple weeks. One other question, I was actually thinking about this. So some of the drivers we have spoken to are actually working longer hours, essentially if they're hauling essential freight right now. So what they're kind of looking for is something that will give them energy over a longer period of time. What's your recommendation for something that they could add to their diet during these times?
Yeah. So, I mean, I'll tell you, Carrie, coffee works great. And coffee is one of the healthiest foods we have on earth. I always joke that that's probably because we drink more coffee than eat broccoli. And that's probably why it's the greatest source of antioxidants. But if you go back and look at the coffee bean, you look at the benefits of coffee in the data, coffee does help with alertness. I did work with Cleveland Clinic on some nurses studies where we looked at what really worked to keep nurses alert on their drive home after a 12-hour shift. And coffee was a great option for that. So coffees, teas, what you want to make sure of, there are some genetic variants that make certain people not metabolize caffeine very well. So that they would be called what we call a slow metabolizer of caffeine. So if you're a slow metabolizer of caffeine, it just takes a long time to get that out of the system. I always tell people you typically don't need a genetic test to figure that out. You just need to know how you feel when you have something like coffee. So if you're getting jittery, that kind of thing, you're probably a slow metabolizer. So you need to kind of space that out. The other thing that I've really been recommending to a lot of people, when you hear this, you're going to say, well, that seems like the opposite because people are going to be like starving, is really, in the case of a truck driver, if you're not on any medications that are involved in blood sugar or anything like that, this is a good time to consider some fasting techniques as well. Fasting actually boosts energy levels in the first few days because it is so foreign to what you may already know, especially if you're eating all day long. It may not seem that way, but after you get into it and after your cells adapt to it, you really realize that if you're eating more with your circadian rhythm, meaning if we take it at the most simple perspective, that is not eating if the sun isn't out, right? So if it's dark outside, you're not eating. Now, I understand in this environment, we probably have a lot of truckers that are driving all night. So that's not going to necessarily work, but you could kind of see, okay, here's my route and I'm going to eat within this 8-hour time frame today. And I'm not going to eat outside of that, right? And just kind of stick to that regardless of what's going on. You can still have the coffee when you're fasting, okay? The coffee is not going to increase blood sugar or insulin as long as it's black. But that's another thing to consider. So I guess the last thing I would say from an energy perspective is avoidance of anything that is very high sugar or refined carbohydrates, because anytime you have a real up and down of your blood sugar and your insulin levels, that's when your energy tanks. And that's when you make really poor decisions, right? So you have something that raises your blood sugar very rapidly, then it lowers it very rapidly. And then you're kind of like, oh my gosh, I'm starving. Like, I just want to eat a donut now because I know that will bring my blood sugar back up. And those are the things that kind of, when I started our discussion and I said there were 2 buckets, that first bucket, sugar and refined grains, are really things that we know do not help with immunity at all. In fact, it could actually lower immunity. So they lower energy, they lower immunity. I know intuitively it may seem that sugar, like a candy bar, would boost energy, but it does the opposite. So lean sources of protein, which you can get anywhere. I mean, any fast food restaurant, if you're doing fast food or quick pick or whatever the case may be, any place you can get a chicken breast, any place, right? So getting some sort of lean protein, focusing on complex carbohydrates if you can. So if you're stopping at a Subway or some sort of sandwich shop, ask for whole grain bread. That will make a big difference, right? Get that fiber in, and then get lean proteins and things like that. You know, those all make a huge difference. If we eat better, our energy is always more sustainable. And then again, with full appreciation of how challenging this can be, getting a little bit of exercise helps with those energy levels as well. And so I know that there's challenges with that in the trucking industry, but even if there's a 10-minute time frame where you can just kind of take a few laps around the truck, get some fresh air, that really helps with energy levels as well. Because sitting in a seat for 11 plus hours, eating a lot of sugary foods, drinking sodas, my God, do not have any sodas in that truck, right? All of those things will zap your energy. And they'll lower your immune system.
Absolutely. No, those are fabulous tips. I think that this will be extremely helpful for a lot of the drivers that we're talking to, where maybe their routine is a little bit off. You know, these past couple of weeks, they're working longer, they're trying to still maintain some of these healthy habits. And I want to go back to another thing you touched on earlier, was the care packages.
Yeah.
So what we've heard is some employers, even family members of truck drivers and other volunteers, are really becoming passionate about putting together care packages and sending it to the drivers,
Yeah.
which I think is phenomenal, you know, in times like these.
Yeah.
If you had to recommend maybe the top 5 things that could go in that care package, what advice do you have for people putting those together?
So I would say, number one, a snack that is going to keep energy levels up, but also be satisfying. So I think of popcorn. That's a great option. So even if it's something like a Skinny Pop or Lesser Evil, these are just some brands that you can find nationwide, and getting a few bags of that. Again, kind of talking to your friend or your family member who's actually driving the truck and seeing, okay, if I send you a whole bag of Skinny Pop popcorn, is there a chance you're going to eat the whole bag? Or should I send you the package that has small bags in it, right? So you also have to like kind of appreciate the packaging perspective as well. So I think popcorn is one. I think making that trail mix is another great option. I think jars of peanut butter, right? They're non-perishable. Your friend who's a truck driver or your family member needs a spoon. That's it, right? And getting peanut butter that is obviously no added sugar. I don't really care about the salt as much, but no added sugar would be a great option. And if it does have sugar, if that's what that person really wants, then getting ones that have a little bit lower sugar, those are options as well. So just a jar of peanut butter, healthy fat, is not going to spike that blood sugar again. So I would say that's another option. Those protein bars and protein drinks. So something that's quick, I can just open the top. I don't have to mix it with water or anything. That's a great option as well. And I think the jerkies, I know that a lot of the truckers that I've worked with before have really appreciated jerkies. I just always really ask that the truckers that I work with really try and stick with better brands, which unfortunately sometimes can be a little bit more expensive, but better brands, homemade as another option, and not eating jerky all day long. Not because it's red meat, but more because the cheaper brands are highly, highly processed. So the one thing you don't want to put in that care package is anything that's highly processed. We know that lowers immunity, that makes people sleepy, all the things we don't want our truck drivers to be looking at right now, and experiencing excess hunger. All of that comes with processed food. So I get it that a bag of popcorn might seem processed to you, but it's much better than some other super duper processed food options.
Absolutely. No, that's extremely helpful. And I think that everyone putting those together will appreciate, that feedback as well. So thank you for that.
Yeah.
Beth, what other questions do you have?
I don't really have any others, Kristin. We really appreciate your time. I know that everybody's going to benefit from this, not just all of our drivers, although that they are our top concern at this point. We've got a lot of people asking how they can help, and I think you gave people some amazing tips for what they could be doing to contribute. And I'm hopeful that the other drivers will be out there sharing this with each other as they're all trying to fight the good fight. I know they're spending lots and lots of time sitting at shippers, waiting to unload, waiting to load. There's a lot of waiting around, and there's some really, really long days and nights, and that gets tough, stressful times. Often boredom and stress tend to make you want to eat.
Yeah, absolutely.
So,
yeah.
It's important that we keep each other safe and healthy during this time. So we really appreciate your help. Let me tell everybody how they can reach Kristin. You can also follow her on Facebook. I know she has amazing FaceTime lives doing some cooking tips and things like that. But you can actually reach her on www.KristinKirkpatrick.com. And she often works with individuals as well as companies, helping to put programs together to help people live a healthier lifestyle. So we really appreciate your time, Kristin, today.
Yeah, it's my honor and privilege to work with both of you, but also to work with this population too. We need them all year round, as I was saying, but we need them more than ever now. They got to stay healthy for us.
That's right. That's absolutely. We all need to pull together to make it happen. So thanks for making this happen. We appreciate you and all the great work that you do.
Thank you so much.
Take care.
Kristin.
Bye-bye.
Bye.